Let me ask you something. You wake up every morning, you open that cabinet above the bathroom sink, and you take your vitamins like clockwork. Vitamin D, calcium, maybe a B12, some fish oil, a multivitamin your doctor recommended 3 years ago. You feel like you're doing everything right. You're being proactive. You're taking care of yourself. And honestly, most people would look at that routine and say, good for you. But here's what almost nobody is telling seniors right now, and it's something that a growing number of doctors and pharmacists are starting to raise serious alarms about. Some of the most common vitamins and supplements that millions of Americans over 60 are taking every single day, often together at the same time, can actually work against each other inside your body in ways that are genuinely dangerous. Not mildly inconvenient, not just a little less effective, dangerous. We're talking about combinations that can quietly raise your risk of kidney stones, increase internal bleeding, throw off your heart rhythm, weaken your bones instead of strengthening them, and in some cases interfere with prescription medications in ways that your doctor may not even be aware of. And the most unsettling part? The people most at risk are the ones trying hardest to stay healthy. So if you or someone you love is over 60 and taking multiple supplements, please watch this entire video before you open that cabinet tomorrow morning, because what you're about to learn could genuinely change your health for the better, and it might just save you from a serious problem you never saw coming. Now, before we get into the specific combinations that doctors are warning about, it's important to understand something that most people never think about. When you're in your 30s or 40s, your body handles supplements pretty forgivably. Your kidneys are running at full capacity. Your liver is processing things efficiently, and your digestive system absorbs nutrients at a steady rate. But here's what changes as you get older, and this is something that even a lot of health-conscious seniors don't fully realize. After the age of 60, your kidney function naturally slows down. Your liver processes substances more gradually. Your digestive tract absorbs certain nutrients more aggressively and others more poorly. And on top of all that, the average American senior is taking anywhere from 4 to 6 prescription medications on a regular basis. So when you start layering supplements on top of that, you're not just adding one thing. You're adding complexity to an already complex system. And some of those combinations create what researchers call pharmacokinetic interactions, which is just a fancy way of saying that two substances change how each other behaves inside your body, and not always in a good way. Let's start with one of the most common and most misunderstood combinations out there, and this one genuinely surprises people when they hear it: calcium and magnesium. Now, these two minerals are both marketed heavily to seniors. Calcium for bone strength, magnesium for muscle function, sleep quality, heart health, blood pressure. Both of them are important. Both of them are widely recommended. And a huge number of seniors are taking both of them at the same time, sometimes even in the same combination pill. But here's the problem. Calcium and magnesium compete for absorption in your intestine. They use the same transport pathway to get into your bloodstream. So when you take them together, they essentially fight each other at the gate. Your body ends up absorbing less of both than it would if you took them separately. Now, for magnesium specifically, this matters a lot because most Americans over 60 are already running low on magnesium to begin with. Studies have estimated that somewhere between 50 and 60% of older adults don't get enough magnesium from their diet or supplements because their bodies aren't absorbing it efficiently. And low magnesium is not something to take lightly. It's been linked to muscle cramps, poor sleep quality, elevated blood pressure, increased risk of abnormal heart rhythms, and even a greater risk of type 2 diabetes progression. So if you've been taking calcium and magnesium together and wondering why you're still having trouble sleeping or still getting leg cramps, this could be a major reason why. The simple fix, and we'll get into practical takeaways throughout this video, is to separate them by at least 2 hours. Take your calcium in the morning with breakfast and your magnesium in the evening before bed. That single change can dramatically improve how much of each mineral your body actually uses. Now here's where things get a little more serious. And I want you to pay close attention to this next one because it involves a combination that millions of seniors are currently taking, and it carries a real risk that most people have no idea about: vitamin E and fish oil. Both of these are incredibly popular supplements. Both are heavily associated with heart health and anti-inflammatory benefits, and both of them, when taken together in higher doses, have something in common that can become a real problem. They are both natural blood thinners. Now, individually, each of them has this mild blood thinning effect that in moderate amounts is generally considered beneficial for cardiovascular health. But when you combine them, especially at the higher doses that many supplement brands pack into their capsules, that blood thinning effect can become amplified in ways that are unpredictable. And here's where it gets genuinely dangerous for seniors. If you are also taking a prescription blood thinner like warfarin, also known as Coumadin, or aspirin, or even over-the-counter anti-inflammatories like ibuprofen on a regular basis, adding high-dose vitamin E and fish oil on top of that can push your blood's clotting ability into a dangerous range. We're not talking about a minor bruise. We're talking about increased risk of prolonged bleeding after a cut, a higher likelihood of internal bleeding, particularly in the gastrointestinal tract, and in more serious cases, elevated risk of hemorrhagic events. There was a notable analysis published in the journal Nutrients that highlighted how combination use of these supplements in older adults, particularly those already on anticoagulant therapy, represented an underappreciated risk that physicians needed to be more vigilant about. And yet, because people buy these supplements over the counter without a prescription, they often never mention them to their doctors at all. If you're taking both of these and you're also on any kind of blood thinning medication, that is a conversation you need to have with your doctor very soon. Let's talk about another pairing that catches a lot of seniors completely off guard. And this one actually involves one of the most heavily promoted supplements in the entire industry right now: vitamin D and vitamin A. Vitamin D has become almost universally recommended for older adults, and for good reason. It supports bone density, immune function, muscle strength, and there's a lot of emerging research around its role in reducing inflammation and supporting mood. Most seniors are taking it, and many doctors are actively telling their patients to take more of it because deficiency is so common. But here's what a lot of those same doctors don't always bring up. Many seniors are also taking a daily multivitamin that contains vitamin A, or they're eating significant amounts of foods like liver, dairy, and fortified cereals that are rich in a form of vitamin A called retinol, not to be confused with beta-carotene. And when you have high levels of both vitamin D and preformed vitamin A in your system simultaneously, they can interfere with each other's metabolism in the liver. Research, including work published in the American Journal of Clinical Nutrition, has suggested that high intake of preformed vitamin A can actually counteract the bone protective benefits of vitamin D, potentially increasing fracture risk rather than reducing it. For a senior who is specifically taking vitamin D to protect their bones, that's a deeply ironic and entirely avoidable problem. The practical guidance here is to look at your multivitamin label specifically. Check how much vitamin A it contains and whether it comes from retinol or beta-carotene. The beta-carotene form is much less of a concern. The retinol form in high amounts is where the issue lies. And while we're on the topic of vitamins that can work against bone health when combined incorrectly, we have to talk about one of the most surprising and counterintuitive findings that has been circulating in the nutrition research community over the past several years. Taking calcium supplements without adequate vitamin K2 might actually be increasing the risk of arterial calcification, meaning calcium deposits in the arteries rather than in the bones where you want it. Now, this is important because for decades, seniors have been told to take calcium supplements for bone health, and that advice has been widespread and well-intentioned. But emerging research has highlighted that vitamin K2 plays a critical role as a director of sorts, essentially telling calcium to go into your bones and teeth rather than into your soft tissues and arterial walls. Without enough K2 in your system, supplemental calcium may end up in places it shouldn't be. This doesn't mean you should stop taking calcium, but it does mean that the way you're taking it matters enormously. Some cardiologists and integrative medicine specialists are now recommending that seniors who take calcium supplements also consider vitamin K2, specifically the MK7 form, as part of their regimen. This is still an evolving area of research, and you absolutely should discuss it with your own doctor, but it represents a real shift in how nutrition scientists are thinking about supplement combinations rather than just individual nutrients in isolation. Here's something that I think is one of the most underappreciated issues in senior health right now, and it connects directly to what we've been discussing. The problem isn't just which supplements you take, it's when you take them and what you take them with. A lot of seniors take all of their supplements at the same time, usually first thing in the morning with a glass of water or with breakfast, because it's easy to remember and it feels efficient. But your body doesn't experience it as efficient. It experiences it as a flood of competing compounds all arriving at the same time, competing for the same enzymes, the same absorption pathways, and the same metabolic processing capacity. Fat-soluble vitamins like A, D, E, and K need dietary fat to be properly absorbed. So if you're taking them with just water or with a very low-fat breakfast, a significant portion of what you're swallowing is going to pass through without being absorbed properly. Water-soluble vitamins like C and the B vitamins can generally be taken anytime, but in very high doses of vitamin C can actually affect how your body absorbs certain minerals, particularly copper. Iron, if you're taking it, should be separated from calcium by several hours because calcium dramatically inhibits iron absorption. And zinc and copper have a well-documented antagonistic relationship, meaning that high doses of zinc deplete your copper levels over time, which can eventually contribute to neurological symptoms and anemia, issues that are particularly serious for older adults. The complexity here is real, but the takeaway is actually pretty manageable. Spacing out your supplements, being strategic about what you take with food versus on an empty stomach, and being aware of which ones compete with each other can make a genuinely meaningful difference in how well your body actually uses what you're giving it. Now I want to address something that may be making you feel a little overwhelmed right now, because if you're anything like most people watching this, you're mentally running through your own supplement cabinet and wondering whether you've been doing it all wrong. Let me be clear about something important. The goal here is not to scare you away from supplements. Many of them, when taken thoughtfully and appropriately for your individual health situation, offer real and meaningful benefits. Vitamin D deficiency in seniors is a genuine and widespread problem. Omega-3 fatty acids from fish oil have a substantial body of evidence behind them. Magnesium, B12, and several other nutrients are legitimately harder to get from diet alone as you age. The point is not that supplements are bad. The point is that more is not always better. That combination matters as much as individual choice, and that your supplement regimen should be treated with the same thoughtfulness as your medication list, because in some cases they effectively are medications. Think about this way. You wouldn't take two prescription drugs together without checking whether they interact. The same logic applies to supplements, especially for seniors whose bodies process these substances differently than they did 20 or 30 years ago. There's one more combination I want to make sure we cover before we get to the practical guidance portion of this video, and this one specifically involves people who are managing blood sugar or taking any kind of diabetes medication. Chromium and alpha-lipoic acid are both popular supplements that are heavily marketed for blood sugar management and metabolic health. And individually, there is some research supporting their potential benefits. But when taken together by someone who is already on metformin or another blood glucose-lowering medication, the combined effect can push blood sugar lower than intended, potentially causing hypoglycemic episodes. For a senior, a hypoglycemic episode, meaning blood sugar dropping too low, can be far more dangerous than it might be for a younger person. It can cause dizziness, confusion, falls, loss of consciousness, and in severe cases, serious cardiac events. And because supplements are perceived as natural and therefore safe, many people never think to tell their doctor they're taking them. Their doctor adjusts their medication dosage based on what they know, but they don't know about the chromium or the alpha-lipoic acid, and the interaction flies completely under the radar until something goes wrong. If you are managing diabetes or pre-diabetes and you're taking any supplements marketed for blood sugar support, please make sure your prescribing physician knows exactly what you're taking and at what dose. So what can you actually do with all of this information? Here's the practical side of what we've covered today. The most important step you can take is to do what experts call a brown bag review. That means gathering every single supplement and medication you're currently taking, putting them all in one place, and bringing them to your next doctor's appointment or pharmacist visit for a comprehensive review. Not just a quick question at the end of your appointment. A real dedicated conversation where someone who understands drug and nutrient interactions looks at your full picture. Many pharmacists are exceptionally well equipped to do this, and it costs you nothing beyond the time to ask. Second, read your labels carefully and look specifically at dosages. The tolerable upper intake levels for vitamins and minerals are set for a reason, and many over-the-counter supplements, particularly the premium high-potency formulations that are aggressively marketed to health-conscious consumers, contain doses that push right up against or exceed those levels. More milligrams does not mean more benefit. In many cases, for seniors, it means more risk. Third, consider spacing your supplements strategically rather than taking them all at once. Take your fat-soluble vitamins with your largest meal of the day, separate your calcium and magnesium by several hours, and keep iron away from calcium and high-fiber foods that block its absorption. These timing strategies don't require you to change what you're taking, just when and how. And fourth, if you've made recent changes to your supplement regimen and you've noticed new symptoms, whether that's unusual fatigue, digestive issues, changes in how your wounds heal, new muscle cramps, mood changes, or anything else that feels out of the ordinary, don't dismiss it as just getting older. It might be worth looking at whether a supplement interaction could be a contributing factor. One thing that genuinely matters and that doesn't get talked about nearly enough is the quality and form of the supplements you're taking. Not all forms of the same vitamin are created equal, especially for older adults whose absorption is already compromised. For example, magnesium oxide, which is the cheapest and most commonly found form in drugstore supplements, has an absorption rate of roughly 4% in most people. Magnesium glycinate or magnesium malate, on the other hand, absorb significantly better and are much gentler on the digestive system. Vitamin D3 is better utilized by the body than D2, and the difference actually matters when you're trying to get your levels into a therapeutic range. Folate in the form of methylfolate is better for people with certain common genetic variations that affect B vitamin metabolism, while folic acid, the synthetic form found in most multivitamins, can actually accumulate unmetabolized in the blood of people with those variations. These are the kinds of details that supplement marketing almost never tells you, but that can make a real difference in how well your body actually uses what you're spending your money on. Here's what I want to leave you with, and I mean this genuinely. The seniors who are thriving the most, not just surviving, but actually feeling vital, energetic, mentally sharp, and physically capable well into their 70s, 80s, and beyond, are not necessarily the ones taking the most supplements. They're the ones who have taken the time to understand their own bodies, who have built real relationships with their healthcare providers, who ask questions and advocate for themselves, and who treat their health as a dynamic and evolving project rather than a static checklist. Supplements can be a meaningful part of that picture, but they work best when they're chosen thoughtfully, taken strategically, and reviewed regularly. The information in this video is a starting point, not a final word. Every person's body, medication list, health history, and nutritional needs are different, and there is genuinely no substitute for personalized guidance from a healthcare professional who knows your situation. Now, I want to hear from you because this is actually a conversation I think is really important to keep going in this community. Have you ever had an experience where a supplement caused an unexpected reaction or seemed to interfere with something else you were taking? Or maybe you've had a doctor or pharmacist flag an interaction that surprised you? Drop your experience in the comments below because the things that have happened to real people in this community are some of the most valuable and relatable insights that other seniors can learn from. Your story might be exactly what someone else needs to hear to make a safer and smarter choice. And if you found this video genuinely useful, please share it with a family member or a friend who you know is taking supplements, because this is exactly the kind of information that tends to stay buried in medical journals while millions of people make avoidable mistakes every single morning. Hit that like button if this opened your eyes to something you hadn't considered before, and subscribe if you want to keep getting honest, research-backed health information specifically designed for seniors who take their well-being seriously. Because you deserve information that actually helps you make better decisions, not just information that makes you feel good for a few minutes. Take care of yourself, stay curious about your health, and we'll see you in the next one.